So the modern advancements of sleep surgery has been tremendous. If you go back even 20 years ago, what they were doing is standard UPPP or UPPP, which essentially means cutting out certain parts of the muscle in the throat in order to widen the back of the throat. And what they found was if you had the perfect anatomy, like massive tonsils and a small tongue base or a smaller tongue, they tended to get better because the collapse was at the tonsils, and you take the tonsils out, that they get better anyway, and cutting the palate out might make them better. But if there was any difficult anatomy, which is like small tonsils and unfavorable anatomy, they did quite badly. In fact, the scar itself contracted and closed down, making the airway narrower. So they may benefit for a few months, but eventually they become quite bad again. So the modern advancements have been as a result of those mistakes and knowledge, where we move forward and do surgery in a way where we use, like the technique I do is what you call barbed reposition pharyngoplasty, and the barbed is the type of suture we use, and repositioning is to lift the palate up and anchor it to the side parts of the back of the throat, where there's a raphe or a fibrous thickening called the pterygomandibular raphe. Without getting too technical, it's literally lifting the palate up. So even if it's scarce, there's no cutting out to contract, it just lifts things up. The other things we do is tongue reduction techniques. There are various quite invasive and less invasive techniques, and I tend to use just coblation, which is a very gentle way of melting the tongue tissue to contract the tongue. And that's a modern advancement where we can offer tongue reduction without being overtly invasive. And also the procedures we do widens the throat as well. So it doesn't just address one anatomical defect, but it addresses all aspects we talked about before. It lifts the palate, lowers the tongue, and widens the back of the throat to improve all. Depending on what we find in our pre-assessment, different patients have different degrees of widening and different success rates. So other reason for modern advancement success is because we assess people properly preoperatively, so we can determine who will benefit the most. And I believe with what we've done, we have avoided sleep apnea machine in over 90% of the patients that we operated. And a greater majority have not needed a device afterwards, but some have needed a device. That's the whole reason for a combined approach, where we can say, look, we can get you a lot better, but you might need something more.